Hello, welcome to Soundplex Studios. We're in Studio A, and I have a local lens broadcast that I want to do with a special guest. Her name is Malini Khanna, Dr. Malini Khanna. And I met her probably about a month ago, and I visited her clinic in Moorestown, New Jersey, which is a great town. It's not too far from here, so I'm going to start visiting it very frequently because she put me in one of these massage chairs. I didn't want to leave. So it's a great space. So we're going to talk about her clinic and her philosophy around wellness, more of a holistic approach, but she does have pain management as well and so on. And it's a well-staffed clinic, and we're going to show a little video in a little bit, but let's meet Malini Khanna first. And she's going to tell us a little bit about herself because there's a great history there. And anyone that's in this space always has an interesting story how they got there. So why don't you share some of the history of you and your life and how you got to this point today where you're running this this non-traditional clinic, and we'll do a deep dive on that as well.
Okay, I can start from medical school. I went to George Washington University in Washington, D.C. I'm from that area. Then I came
Wait, how was your grades? Were your grades good?
I mean, I worked really hard. Yes, I had good grades, yeah. And then I came to University of Penn for residency. So that's how I ended up in Philly. And then I got my first job in South Jersey. So I ended up staying here. So that's kind of just how I ended up here. I'm born and raised in Virginia, right outside of DC. A lot of people think I'm Hawaiian, but I'm actually of Indian origin. My parents came from India. So that's kind of how I came about to be in Philadelphia. How I came to the field that I'm in is kind of interesting. It's called Physical Medicine and Rehabilitation,
Okay.
PM&R. It's also known as physiatry. It's not a very...
Wait, what's that word again?
Physiatry.
Physiatry. I've never heard that before. Okay.
Yeah. So it's a field that's been around for a long time, but it's just not in the mainstream medical world.
No, it's not.
So a lot of people don't understand when they ask, what type of doctor are you? And I say, I'm a PM&R doctor. So it's a lot of explaining that, we do rehab. We specialize in all types of rehab. You can go into stroke rehab, sports rehab, traumatic brain rehab. It's a very wide specialty. I chose to go into the sports and spine rehab because that was where my interest is. So that's a little thing I just wanted to explain to people, that it's a field that's growing and it's becoming more popular among the medical students because of how much we can help patients with their function.
Right. Why that field, though? Like, what made you get into that? Was there anything specific? Because I always wonder why doctors choose a specific field. Is there just something that is of interest, or is it like just a passion, or what is it?
Well, they used to call it plenty of money and relaxation. So that was what drew me to.
That's enough. That's all you have to say.
No, I'm joking. It's basically, like I said, it's a field that you have a wide variety, and then you can hone in on what you like. When I was in medical school, I kept changing what specialty I wanted to go into. I thought I wanted to do pediatrics at one point. And then I got really sick on my peds rotation, and I said, never again, we're not going to do that. And then I wanted to go into OBGYN, and I was like, I can't be awake all hours of the night. So that was crossed out. Then I wanted to do primary care, and I was like, again, it's just too much.
Good move there. Yeah. Okay.
And then I kind of just stumbled upon this field. And ironically, out of 175 students I graduated with, only 2 of us went into this field.
Oh, there you go. Less competition.
Absolutely. So
good job. So there's a philosophy there in regards to when it comes to healing and patient care. You probably have a different philosophy compared to maybe a more traditional type physician, correct? I mean,
absolutely.
Yeah. And that's a good thing.
Yeah, I think it's because of the background of physiatry or physical medicine and rehab. A lot of pain clinics you see are anesthesia pain clinics, which are great. They have great skills. They can diagnose and treat patients just as well. But my philosophy comes more from taking time with patients. And that's something that is missed in healthcare. It is the number one fault for why our healthcare is in the shape that it is in. Doctors don't have time.
Yep.
They simply don't have time to listen to the patient. And I was in a practice where it was about how much can you produce, how many patients can you see in a day, how many injections can you do in a week, how much money can you bring in for the practice. And it just got overrun by the administration telling us when we could do procedures.
Right.
You can wait 2 weeks because we have to get authorization. And I said, no, the patient's in pain. We get authorization now. And there was a little bit of back and forth about the administration and my view of how I wanted to do things.
Yeah, and it seems very transactional, because I've been in healthcare for a long time in a different field, more post-acute care, but even your visits to the physicians are very rushed. And that's not what people want. I mean, if you line 100 people up, they want more time with their physician, especially my mother. I mean, my mother was like adamant about that. And she made a point to be, hey, I'm not done with you yet, you know? And it's hard to do now because now they have all these quotas and restrictions. And that's probably a very good reason why you went into the field you are, or you've built this clinic that's not traditional, because that's a big motivator. And I think there's a lot of opportunity for that type of care because, and the other thing is you're taking the whole body approach to it, you know, the holistic approach, because it's all about mind and body, and it's full body wellness, you know, and that's kind of your approach. And that's the first kind of impression I got when I visited with you at your clinic, which was great. So, you know, we can talk about that traditional issue. How do you, I mean, when people come into your clinic, they're coming from an experience of that traditional approach. Mm-hmm. What is the first thing they're saying or doing or saying when they come to your clinic? I mean, what's that like when that first patient or those patients come in for the first time that you're meeting? What's that process like?
Usually they have told me I've been to 3 or 4 doctors and I'm not getting anywhere. That's kind of the frustrated patient.
Wow.
And then there are other patients that come in and say, wow, I can't believe I got an appointment. I called yesterday and I'm in today. So that's also feels good that the patient can get in right away.
Yep.
We're not giving them a 6-week wait list.
So typically how long, like before when they call and then they get an appointment, what is that, a week, 2 weeks or?
No, we can get them in usually within the week.
Wow.
Yeah, sometimes next day. The only thing, unfortunately, that does restrict us is insurance.
Right.
We have to run benefits. We have to find out if they're out of network or in network. And it's a complex system behind the scenes that not a lot of people understand. So, you know, if we don't know what their benefits is, we can't tell them transparency of how much they're going to owe when they come in. And that's another thing that we are very big on. You have a high deductible. We ask for you to pay up front. We're a small practice. This is just the way it is. You know, like, you know, we have to pay for supplies. We have to pay for rent.
Yeah.
We have to keep the lights on. So we are very transparent. We let them know what their deductible is. We give them a cash pay price to begin. And then as they're eating away at their deductible, then the insurance will kick in. And, you know, we have everything listed on our website if they're not sure how much they're going to pay.
Yeah, I saw that on your website, which is great because at least people see it. They know what the cash purchase is.
Right.
And they see it. So if they're calling after that, they're going to know, hey, okay, if it's out of pocket, it's out of pocket.
Right.
Because someone's health, what's that worth to you? You know, and I'm not saying, you know, everyone is a candidate to come into that environment, but a good majority, especially like I asked you, and what's the number one reason why people come into your clinic?
Low back pain.
There you go.
Low back pain
and that's that's debilitating. And it's, you know, I went through it. I had sciatica. It was brutal. And it was like, you know, you couldn't do anything, you know, but that's probably the primary reason. And I think today, just the way people live their lives, we're all sedentary. We sit down at the desk, we're hunched over, we're looking at our phone, et cetera, et cetera. All those things lead to bad alignment, et cetera. And to come into your environment, and I'm speaking from experience because I was at your environment and saw what it was like. I can see that as being a very just a relief to see that you're speaking with a doctor and you're dealing with all those things. So tell us about the clinic side, and we'll get into the Zen room, which I love to talk about. you have another physician that you brought on as well, correct?
Correct. So we've been open in Moorestown for almost 3 years. I brought Dr. Beth Checkerman on about 6 months ago because I was getting too busy to run a business and be a doctor. It was just too much to handle and to have my vision come to life. So I needed help from the medical side. So we do traditional medical care in a sense that we see lower back pain, we see neck pain, shoulder pain, knee pain, hip pain, or any kind of non-surgical pain
Right.
we can take care of. So that is the medical side of the office, that one side of the hallway. We are seeing the patients for that. And then we offer things that are not traditional, like PRP, platelet-rich plasma, which I prefer to steroid injections. Steroid injections are like Band-Aids. They just
Mm-hmm.
help calm inflammation down. They have a use, but it's not always the best
Right. I agree.
reason to be putting steroid in someone's body, especially if they're diabetic or if they're have had several steroid injections. You just don't want to keep doing it. So we offer the PRP. We offer something called Soft Wave, which is PRP without needles. It brings shock waves to the area and helps regenerate the tissue.
Oh, okay.
So that's Dr. Checkerman does that. We also do the traditional epidurals, facet joints. We burn the nerves for pain relief for the knee and the back. We also have a meditation program, and that'll kind of bring us right into our Zen
into
room.
the Zen room.
Yeah.
Well, before we do that, I want to show that short video that we have that shows the clinic. We'll see some of your staff, and we'll end up with that Zen room, and then we'll talk a little bit about that. So, Chris, why don't you show that video for the folks out there? All right, folks, that was the clinic. And we're going to actually be visiting there probably in a week or two to take some more shoots. And we'll share some Instagram shorts as well. But let's talk about the Zen room, because that's important, because I spent, I guess, maybe 30 minutes sitting in that chair, and we just had that discussion. And it felt like, I go, wow, what a great room to just chat with someone in. And you had a nice TV in there. The lighting was cool. You had some mats. And that chair was unbelievable. I had my feet were being massaged. My whole body was being massaged at the same time. So I know that's important to you, and you want to build that out and get more exposure for that. So tell me, what's the motivation there? And tell me how you want that to evolve as a bigger part, or not a bigger part, but an important part of your clinic experience.
Yeah, absolutely. So the Zen room came about when I was working, those like 50-hour weeks, you're on your feet all the time. We were doing injection after injection after injection in the x-ray room. Our really good friend, Jen Ward, and I would work together for hours on end doing these injections and working like side by side. We kind of, we had a great relationship. And at the end of the day, your feet are swollen, your feet are tired. And we would always just look at each other and just say, I wish we could go to a Zen room and just put our feet up, because we were both married with kids, and we had to, go home and then be the mom and take care of our little kids. And this is something we said, I think every Thursday, because Thursday was our injection day. I just want to put my feet up and go into a Zen room. So what ended up happening, which is really sad, is that she ended up passing away from cancer.
Oh my God.
And we watched it, the whole practice. We were like a family at that time. This is before the big administration had come in. We were a family, and we watched her get diagnosed to the day she died in the hospice. And it was just so traumatic for all of us. And, we just loved her to death. She was one of my closest friends. I actually did a eulogy at her funeral.
Oh boy.
So she was just my inspiration to make this Zen room because, this is what we always wanted. We wanted a space to just put our feet up before we go home, or or a space to just kind of just get away for a little bit, like just take time away from your busy day. And like you said, you could have spent 30 minutes in there and fallen asleep, or you spent 30 minutes in there and you just chat with someone, and you enjoy it.
Yeah, your motivation is very, no, I mean, sometimes life throws a big curveball at you, and you can kind of get down and out about it, or you can make it an inspiration to do something good. And that's what you've done. You built a room that you and her were very passionate about, and now you have it. Okay. And that's great, because I'm a big believer in living in the present now. I've learned the hard way. You can't change the past. You got to live in the present. You got to live for today. And I make the best use of every day I can possibly do. And my best use the day that I met you was sitting in that chair, getting my feet massaged. So that, and part of this broadcast is that I get to use that Zen room at least once a month for the rest of my life.
Yes, as much as you're welcome anytime.
So here we are. We have the Zen room, and I know that's important to you, and I think it's important to everyone to have those types of experiences. How do we get over the hump? How do we, we can certainly share what the room does and what it means to people. And it is a mindset. It's a whole full body type experience. And I think healthcare has to be positioned that way. If you have pain in your arm, it could be a lot of things. It could be what you're eating, the way you move. So it's a full body thing. And I think that's got to be the approach. So how do you take what you've built and move it towards the point where, okay, now we're getting people in here and so on. And we'd love to help. And that's why we're doing this, because we want to get you some exposure. We think you're in a great spot. You're in a great location. But it's obviously awareness, and we're trying to build awareness for your spa. So what can you do, and what other things do you have planned to kind of get some more exposure with the Zen room and get people in your door? Because I know, being rushed and having no time with doctors is a pivotal motivation. But
right. So that's one side of the hallway. The other side, kind of full circle, is that once you are feeling better from the medical side, you really need to work on your mindset.
Yep.
And that's missed in healthcare. Once again, yes, we have psychiatry, but that's medication based. It's talk therapy. We don't do enough mindset, positive reinforcement, positive thinking, future positive, just thinking about how to just change our negative thoughts into more creative thoughts, more things that help us move forward, like you were saying in life. So to make the full circle is that once you feel better, the plan is that you would come over to the Zen room side, or you can use it while you're getting treatment, and you take our meditation program. And that program is an 8-week program, and it's self-paced. It's done on an app. And then we put groups, usually 4 patients or 4 people if they're not patients, together. And I meet with them for an hour every week in our Zen room.
Oh, okay.
So we've run the program a handful of times with patients that were interested, and we're trying to kind of get more people excited about it, because a lot of times people say, I don't have time for that.
Right.
And we really need to make time for that.
Yeah, they really do. It has to be something like, just like anything else. You make time for all these other things. There has to be a wedge of time in your day to experience that as well, because it can only benefit you and help you in all those other aspects.
Absolutely. And my phrase has now been, mental fitness is just as important as physical fitness.
Yeah, you got that right.
We go to the gym, we go lift weights, we're, becoming more health conscious. The GLP-1s are helping people lose weight, but no one is working on the mindset.
Right.
So you've got the physical fitness, we've got to focus on mental fitness. And that's what I'm trying to bring to the community. And that's another thing I also wanted to bring up is community. a lot of people who are in pain are in a state, they're just very lonely and they don't feel heard. They feel not heard by their doctor. They don't feel heard a lot of times by their family because the family's sick of hearing the same thing over and over again. And when I bring these patients into this mindset program, they have a community and they can kind of relate to each other on how, like, oh, I had that same problem, so that's why I like doing the groups, because they can share
Yep.
that even if it's not about pain, it's about, husbands, or
Right.
it's about children, or it's about any life problem that they're having. They can share it together.
Yep.
And, I really enjoy those sessions.
That makes sense, because I think in a group, once you start getting comfortable, people start sharing more than you would think. They started getting very close to one another.
Mhm.
And when you see someone having maybe the same issues or the same problems, it makes you feel a little bit better, because everyone's living in a silo, and we're living through this conduit of our phone, and there's a lot of loneliness out there.
Mhm.
And with that, comes all the things that bother people, whether it's a physical issue or a mental issue, and they dwell on it. So
Mhm.
to change the mindset, it has to be repetitive. Just like no one exercises once a month and gets anything out of it. You got to
Right.
do it every day.
Correct.
So the mindset has to be done on a frequent basis too. So I think that's a great approach, and I think we can, I can get behind that, because something like that is very meaningful, and nothing's easy,
Mhm.
and because people are entrenched in their way, you know how that is.
They want a quick fix.
They want the quick fix.
Mhm.
Give me a script, give me a script. And the doctors don't help any, because they're writing the scripts, oh, you got pain, boom, write a script, and so it really just, that whole pharma and thing, we can go down a rabbit hole with that all day long,
Right.
and it gets pretty deep. But I think you're on the right approach there. So what, like today, what does your typical patient look like? Like I have that question here, and I always wonder, like, who's coming in your door? I know the people that have the back pain, but are you getting some positive traffic in regards to that whole mindset body experience? Are you starting to get people like that in there to kind of feel, or experience the whole process of what you're trying to deliver?
Slowly.
Okay.
Like I said, we have run the program a handful of times, but it's a lot of pushback because of the time
Yep.
commitment. It is not covered by insurance, so there's a lot of pushback with that. I wish it was. There's just nothing I can do with that right now, but maybe one day. So people will pay for gym memberships, but they don't want to pay for mindset
Right.
programs. So the way around that, I have also provided uh, something called continuing medical education,
Okay.
CME. So physicians, nurses, PAs, dietitians, social workers, they can all take this course and get continuing medical education credits. So I have worked with a company that has now allowed me to offer 30 credits, because we're required to get, I believe it's 200 CME credits every 2 years for our medical license. So all healthcare has some type of requirement. So I've tried to make it so that healthcare workers can get their CME, so maybe their employer would pay for the
Okay.
meditation program because they're treating the patients.
That makes sense.
So I've got the CME program up and running. And then the other half of it is that, we take the HSA, FSA, we try to make it work as much as we can, because,
Right.
we really care about the patient,
Yeah.
but
That's
just,
the challenging
yeah.
part. And I think even local businesses would be interested in having that, because a healthy employee is a more efficient or effective employee. So, there's that whole approach. And, you're in an education space, you're educating people, and it is against the grain, because people are, they're used to the traditional methods. But you're like sitting on a great opportunity, because I think people are moving more in your direction. And if it's going to be out of pocket, it's out of pocket, and certainly people save money for a trip to so and so. They have these saving programs. They want to put money away for a rainy day. Well, guess what? The rainy day is now. If you don't feel real good and your mind's not right, it's time to take that approach. So
Absolutely.
I think you're on to something, but as I always say to everyone I come in contact with, nothing's easy. No matter what you do, nothing's easy. But I think what you're doing is great. So I think your vision, we talked about that, where this is going. Do you see this blossoming into something more? I mean, I know we don't like to think too far ahead, but is there any on-site type stuff that you're planning to do or anything like that, where you can kind of do some reach outs, even to some facilities that maybe like, not post-acute care, but like there's a lot of these senior living type communities which can benefit from some of your Zen-like type stuff. Is there any, community reach outs that you're doing there, and even in Moorestown, like the community center, or doing any type of, exhibiting at like community days and stuff like that?
Yeah, I mean, we try to do as much as, well, I mean, a lot of it's marketing. Like in Moorestown Day is coming up June 5th or 6th. We did Daffodil Day in Moorestown.
Oh, Daffodil Day.
Yeah,
I missed that.
That just passed.
Darn.
So we try to get out there more for marketing purposes. It's hard to kind of explain what a meditation program is.
You got to come on site.
Yeah. So it's more, we need the foot traffic. We need people to come in and see the Zen room and just come and just get a massage in the chair. I mean, we have very reasonable prices. He said, just come for like $20 for half an hour, just so you can see the room. And then it goes $40 for a full hour. And then you can bring your friends. So you have, it's a room with 4 chairs facing each other. And, that's the whole community, is that you can bring your friends, you guys can get a massage while you talk. Or, at one point, my idea was to put 4 strangers together, which I have done through my meditation program. And they get to talk while they're getting their massage. And then and then we talk after they're done. And that's, we talk about the meditation program. So, about where it's headed, my big aspirations is that, like, I'll open multiple offices in multiple cities, obviously starting in South Jersey. I have a huge following from Sewell because I worked there for almost 10 years.
That's your next spot.
So I already know, my mind is already looking at real estate in Sewell. So
that's great.
And then we'll just go from there. And then, big picture is that, yes, I can take this nationally, but I don't know if we'll get there.
It seems scalable. So, well, let's conclude with that thought, because I think I'll say this. I've been there. I like the spot. It's very warm and inviting. And like I said, those massage chairs are hard to get out of. So we're going to pay another visit in a week or two. But we want to make sure that everyone knows. Give us the name of the business, okay? And give us the address as well. And we're going to post your website on the, after this broadcast, we're going to post that and a few other of your social media videos that are important to meet the staff and stuff like that. So we'll put that as part of the broadcast. So folks, after you watch this video, if you're not here live, but after you watch it, check out in the discussion section. We'll have a bunch of other videos of the clinic. And so any last words you want to share with the folks? You want to give out I think we have your website up there. That's fine. But give us the name of the business again and where it's located.
Sure. It's called Moorestown Spine Sports and Wellness. It's located in Moorestown, New Jersey. It's at 200 Martyr Avenue, Suite 700. It is it's in a great location because it's right off the highway, right off 295.
Yep.
You've got the Wegmans and Costco kind of catty corner from there. It's at the corner of Main Street, Martyr Avenue, Borton Landing. Everybody knows that area.
Yeah, it's a great spot.
So
it's easy to get to.
Yeah, and it's a brand new building. So it's a great spot to just come be a patient at. And then if you like what we do, continue on and continue with the mindset work.
Yep. And even if you're in the neighborhood, just pop in and say hello. I mean, that's a good way to get a feel for the place, because you do tours. You got staff there, so they can just give you a quick tour. So
absolutely.
Stop on over. And folks, welcome, or thanks for coming today. And I hope you enjoyed the broadcast. Check out our website, and then also check out the posts that we'll be putting out after this video's done. And pay a visit to Malini Malani.
Malini.
Malini. I can't believe I got that wrong.
It's okay. It's
Now I'm in trouble. Now I'm only going to get one visit a year into the massage room.
That's
Well,
okay.
thanks, folks, for showing up today, and we'll talk to you soon. Bye-bye.
Bye-bye.